Hello everyone, this is 1 year on. I'm Alison. And following on from the previous episode, today's episode is a temporary sidestep from my interview series. I'm going to be speaking about my experiences in my recent 3-night hospital stay. Trigger warning, I will be describing some gruesome hospital details. If you are eating when listening to this or are squeamish, it may be better that you skip this episode. I recently had the experience of 3 nights in a private hospital, which is the first time I've had several nights stay in any hospital other than when my first child was born. I was well prepared, or so I thought. I had asked several people before what to take for this particular stay. I had purchased a long mobile phone charging cable. I had specific clothing suitable for me for after the surgery, hand wipes, notepad, everything I could think of. Magazines, a book, but I didn't have noise cancelling headphones. But I had my trusty loop earplugs, which have served me very, very well. But that didn't help me with the sensory overload of the hospital. Due to me having had the stroke, the anaesthetist thought that it was prudent to send me to the post-operative intensive care unit, where I was to stay for 18 hours post-op. Then I could be moved to an ordinary ward to my own room. I remember coming to with a barrage of sound, light, everything. ICU is not for the faint-hearted. Every machine that goes beep you can imagine for multiple people. I believe there were 6 patients in the ICU. I was connected to a catheter, a heart monitor with 10 pads on my chest, oxygen mask, leg squeezing things to prevent DVT, a finger thing to measure my oxygen levels, blood pressure fancy pants thing through one cannula port on my right arm, and a second cannula port in the middle of my hand on the right hand for medications, the drip and the like. I think that's everything that I had. It was a lot though. They tried to give me the oxygen through the little nose spike things, but that's no good for me, too sensitive. So I was able to say no and they didn't push it. I could barely move though, with all these tethers, and that was really difficult. I remember my mouth being so dry and asking for a drink. They gave me a jug of water and a cup, and I started drinking and drinking and drinking. My mouth was still dry. I was told I could press the button for pain relief every 6 minutes if I wanted. I wasn't really in pain, so I only pressed it 8 times in 6 hours. My anaesthetist was clever. He gave me nerve blocks, which were amazing, and gave me a very intense experience of barely any pain after really major abdominal surgery. And I expected this to be a lot more intense, but it wasn't. But what I didn't expect was the ICU to be completely overwhelming. I should have, but I didn't. Remember the water? Well, I drank so much because my mouth was dry. I ended up springboarding it back up and projectile vomiting over myself. Not once, but twice. And the bed and the oxygen mask. That was good. The first oxygen mask, I remember, was quite uncomfortable. The second mask was nicer. I have no idea what it was called. I should have asked them because it fitted well. And yes, after the second vomit, I managed to not throw up on that mask. I liked that one. But what didn't fit me well was the lack of sleep, the lack of rest, the lack of peace and quiet in this place. Even through the night, they were intensively monitoring me. Well, that's what they're supposed to do. And there were lots of loud conversations, enormous amount of disruptions, and no sleep at all. They had put a blood pressure cuff on my arm when the artery one didn't inflate. The artery one didn't work. The blood pressure cuff inflating and deflating. The heart monitor beeping intensely and alarming when my respiration fell as I was drifting off. And that promptly woke me up. One person next to me coughed the entire night, which must have been really awful for them. And I thought actually they were vomiting themselves, but I think it was just coughing. And anyone who could hear, it must have been awful for them too. I had my earplugs in, I think, but that didn't make any difference, strangely enough. In the morning, which was the continuation of my night, I was so severely distressed by having no sleep and having all that overwhelming noise. I told the nurse that I just wanted to go home and that this place wasn't helping my mental or physical health at all, as I'd had no sleep, and that the sensory overload was totally overwhelming. I suppose this is their life, where they work. The thing is, I went into hospital thinking I was going straight from the operating room to recovery and then to the ward. I only learned of the ICU requirements in the pre-op room, and so was mentally ill prepared. I also didn't bring a sleep mask, as we sleep at home in the dark in silence. And of course you can artificially make a place dark and quiet if you know this is where you are going to go. So note to self, always take noise cancelling headphones and not just earplugs to any place that you're not quite sure of, because you might just need both. After my disastrous experience in the ICU, I got out of there to the ward by lunchtime the following day, and it was so much better. I had my own room, but I was still tethered to the bed by the calf cuffs, the catheter and the drip. My directive was to get up as much as I could and wander around the ward, and of course they jab you with Clexane to stop blood clots forming. So trying to get out of bed was really difficult, because I had all these devices attached to me on a different side of the bed. So in the end, because I was fed up with all this stuff, I engineered to shift the catheter bag around to the same wheeled drip trolley, so there were only two things to think about. This suited me and not them. Once I'd managed to do that, I could remove the cuffs when I was walking about and get around with the drip. And once the drip was removed, I felt even lighter. When the catheter was removed, I felt like the world opened up, as I could take the cuffs off, and as long as I was walking around every hour or so, I didn't have to wear them again. Because I'd had that projectile vomiting extravaganza, I really don't do anything by halves. They wouldn't allow me to eat anything. So I'd not eaten anything after breakfast on the day of my operation. The operation was 3:30 p.m. that afternoon, and it had been nil by mouth since 1 p.m. I was in ICU from 6 p.m. or so, and it took until 10:30 p.m. until I was really conscious. And I was drifting in and out of consciousness from 7 o'clock or so. And I had nothing to eat. When I got that water, it was with some crackers. I asked for them because I was totally starving. I hadn't eaten for over 12 hours. I had some crackers and some sweet biscuits, which I never usually eat, but it's all I could get out of them. And then they refused to give me anything else. Apparently, anaesthesia anaesthetises your digestive system, as well as everything else, and this is what had happened to me. The water had nowhere to go, and no one thought to tell me to take sips of water, not big swallows. So nobody explained this to me until much later, but the dry mouth was the result of the anaesthetic anyway. And they didn't give me ice until a lot later as well, which I think was probably a big problem. The thing that was absolutely delicious was the taste of the milk once I was allowed to have food. Nights in hospital were quite okay after getting to the ward. I had some movement and some agency. Getting a shower and washing my hair was simply divine. I'm sure I was allowed to do that the following day after. So after 2 nights. That made me feel so much more human. And getting into my own pyjamas, not hospital gear. That was certainly a step forward. I even got into a little routine of toddling around the floor, doing a few rounds and then resting a bit, and having a chat with the nurses at the bay or other patients also out of their rooms for a constitutional. I realised there was a blue light on all night in the room, which was disturbing. It made such a difference. But I could work with this, and I got my husband to bring noise cancelling headphones and an eye mask from home. Problem solved. And I actually managed to sleep quite well in the wardroom and then I was feeling so much better. Me and hospitals really don't mix, and I really hope to not be back in one for a long, long time, or ever again if I can avoid it. Getting out on Friday was brilliant, and I was walking slowly at first, and coughing, sneezing and moving out of bed were really difficult as I'd had open abdominal surgery, so there's a lot of healing to happen. But I feel so much better and have really noticed a massive improvement in the last week, because my pace of walking has increased and my general feeling of well-being. Being back in your own bed with your own things makes the difference, absolutely, and I am a creature of habit. The thing that really bothers me thinking about this going back overall is that there's not much that can be done in the hospital for them to change anything about the environment, as the machines will still ring the same or beep the same or buzz the same because that's how they are. All the devices are there for a reason and monitored in the same way as they are for a reason, and you as the patient need to fit into their system, not the other way around. That's really challenging for me and my clearly damaged brain, because I thought after my difficult experience last year in Scotland staying with my family, things might have improved. But after this hospital experience, I've concluded that there's not really much change in my experience of extreme amounts of lack of sleep, noise disruption and chaos. And chaotic noise and me don't mix ever now. I think it's a sad fact that I'm having to reconcile with, and I wonder that this will be a constant now, so in the end I just avoid as much overwhelming noise as I can and try and get as good a sleep as I can. Thank you very much for listening. If you've enjoyed this episode, please like, share and subscribe. I'll be back next time to continue our interview series, and I have many more interviews planned. Thank you.